Gather the history of the present illness from family or bystanders, if necessary, using OPQRST and sample. Repeat the initial assessment. Vital signs should be repeated every 5 minutes for unstable patients, those in high priority or rapid transport categories, and every 15 minutes for stable patients. Reassess the patient's chief complaints and repeat the focused assessment as necessary. Determine the effects of the interventions performed. In conscious medical patients, always obtain patient history before conducting a physical exam.
Hi, ma'am. My name is Mary. This is my partner, Brandon.
I'm just going to ask you a few questions here.
Follow the OPQRST approach.
First, what's wrong? What's pain?
I have a terrible migraine headache.
Okay. How long ago did you say this started?
About an hour ago.
Alright. Does anything help with the pain? Sitting down, standing up?
No, not really.
Anything that makes it worse?
No.
Okay. Can you describe the pain for me? Is it like sharp, stabbing, throbbing?
It's throbbing.
Throbbing? Okay. Is it radiating anywhere?
Yes, it's radiating across my forehead and around my head.
Okay. On a scale of 1 to 10, what would you rate it?
I would say a 5.
Okay. And about how long ago was this?
About an hour ago.
Gather the sample history from the patient or from family or bystanders if necessary.
Okay. Do you have any allergies or medications or anything that you know of?
No.
Okay. Do you take any medication?
No.
Okay. Have you ever been to the hospital before?
Yes.
Okay, what for?
Chopper.
What was the last thing you had before the pain started?
A salad.
You said you were teaching class before this all started, right? Okay, just going to finish your photos here and then we're going to get you on.
Okay.
From the information gathered, determine the patient's medical problem and provide appropriate interventions.
Don't understand why they went through that again, but with the reassessment, like they said in the first section, if it's a medical or if it's a critical patient, you're going to do the reassessment every 5 minutes. If it's a non-critical patient, every 15 minutes. Okay, so clinical decision making is going to depend on your ability to gather the information. So you're going to have to gather information from the entire scene, from the scene size up all the way through to the reassessment, and also evaluate how the patient reacts to your treatments that you're providing, obtain pertinent negatives from that treatment or from your exam, and try to make a determination of what's going on with the patient. Now, you may not be able to figure out what's wrong with the patient. That's okay. That's why we're not doctors. But we should be able to identify life threats and mitigate them, which means that we're going to try to make it where it's not a life threat anymore, okay? If the patient has an airway obstruction, what are we going to do? Clear it. If they're bleeding, stop the bleeding. All right, so in every assessment, practice critical thinking skills. And one thing you can do is ask questions. A lot of times doctors and nurses are not afraid to talk to you. Now, if they're really busy and they're working 2 or 3 codes, that may not be the right time to ask them, hey, what was going on with this patient and stuff like that. But you can do that. And a lot of times they'll like to help you, okay? Don't just focus on one set of data. Look at everything. Look at the entire scene. Put things together. If you have a patient that has a fever and they're having difficulty breathing and they haven't been eating well for days, that's multiple things you can put together. And now all of a sudden they got this junky sounding chest whenever you listen to it and you auscultate it. You kind of come to an assumption that, hey, Is there an infection going on? Is it pneumonia? Could it be tuberculosis? Could it be RSV? You may not be able to get the specific thing, but you know it's a difficulty breathing, right? And we can know how to treat that. Now, there's going to be data there that's relevant and some that's irrelevant. Like if you're going out on patients having difficulty breathing, the fact that they had food poisoning 2 years ago, is that relevant? No. But you may get that information given to you. Analyze and compare similar situations. Throughout your career, whenever you start doing this, you're going to run a CHF call. Then you're going to run another CHF call. Put those in your mind. Start using those as comparisons. Because you'll start seeing a trend. Like, hey, somebody has CHF, they have pitting edema in the lower extremities. They have difficulty breathing. Their heart rate's elevated. They feel like they're drowning.
CHF, heart failure?
Congestive heart failure.
Okay.
All right, so that's it for the lecture part. What we're going to do now is we're going to take a quick break. We're going to take a break. I know y'all are like, thank goodness. And then we're going to do a demonstration of the assessment. Okay? So get up, stretch your legs. Y'all wake up.